Now, if you overthink venipuncture, you're probably making it a lot harder than it needs to be. Overthinking typically happens when you don't trust what you already know. Venipuncture is a skill, and over time you'll find that it becomes almost like second nature. There are a few reasons why you may overthink: fear of feeling judged, being watched, the fear of missing a vein, or the fear of not looking like you know what you're doing, all of which I can definitely relate to and is completely normal. So instead of trusting yourself and prioritizing patient care, you're thinking about all the tiny movements, all the little steps that need to add up and make sense. The problem with this is that it will interrupt your flow. You may have to constantly adjust, which means that you might lose the vein or struggle to palpate the vein again. And finally, you'll have a loss of confidence. So the first thing to overcome this that I personally do is I create a mental checklist. I have an idea of what steps I'm going to do. I make sure that all of my equipment is prepared beforehand. And this helps me feel more grounded, more comfortable before I start a procedure. It will be something like this. I'm going to greet the patient. I'm going to take their identity confirmation. I'm going to ask if they're feeling okay. Then I'm going to have a look at their arms. I'll ask if they have a preference, and I'll make sure that I'm looking for a nice, straight, big vein that I know would be an easy, quick target for me. I will gather my equipment tray, which will be prepared. Then the next steps would follow. If you'd like more information about the steps of how to do venipuncture or cannulation, please refer to our videos, and hopefully this should help you with making that mental checklist. The next step is to trust yourself. Trust your assessment. Most of the time, your first instinct of where a vein is usually right. And one thing that I would like to hone in on is to actually take your time choosing a vein. For a lot of patients, poking and prodding and trying to find a vein can be quite an infuriating experience, not just for you, but for them as well. It can be quite uncomfortable. So for me personally, I like to make sure that there is a nice, available, palpable vein before I go in with the needle. I like to find maybe 1 or 2 spots. So the goal isn't to think more. The goal is to think clearly before and then trust your hands whilst carrying out the procedure. If you found this useful, please follow the Needle Academy for more, and please comment down if you have any other tips on how to deal with overthinking when it comes to venipuncture, or if you have any experiences where you have overcome anxiety. I would love to know. Thank you for watching, and see you next time. Bye.